Accurate and efficient patient assessment is one of the most important skills an EMS professional can master. In the fast-paced, high-pressure environment of emergency medical services, having a structured approach to gathering patient information not only saves time, but can directly influence patient outcomes. The Opqrst mnemonic is a proven tool that helps guide EMS providers through a thorough and organized assessment, ensuring that no critical detail is overlooked during initial contact and ongoing evaluation. Objective. The objective of this presentation is to provide EMS professionals with a clear and practical understanding of the Opqrst mnemonic. By mastering these tools, providers will be better equipped to gather essential patient history, accurately assess symptoms, and communicate findings effectively with other healthcare teams, ultimately supporting faster diagnosis and appropriate treatment decisions in the field and beyond. We will begin this training by focusing on the Opqrst mnemonic, a key tool used by EMS professionals to assess a patient's symptoms and gather valuable information during a medical emergency. Throughout this section, we will break down each component of Opqrst: onset, provocation/palliation, quality, region/radiation, severity, and time, and explore the purpose and importance of each element in detail. For each letter, we will not only explain what type of information you should collect, but also discuss effective ways to phrase questions and communicate with patients to ensure clear and accurate responses. Real-world examples will be provided to demonstrate how these questions apply in the field, helping you build confidence in your assessment skills and sharpen your ability to gather essential details quickly and efficiently. Whether you are assessing chest pain, shortness of breath, or abdominal discomfort, Opqrst serves as a reliable, easy-to-remember guide for obtaining a thorough patient history and making informed care decisions. Furthermore, although the Opqrst mnemonic has traditionally been utilized to assess pain only, with some slight modification and a little different thought process, it can be used to assess all kinds of patient complaints, including sensations of distress in situations where you might hear your patient said, "It's not so much pain," or even in cases of a psychiatric emergency. When assessing a patient, identifying the onset involves determining exactly when the symptoms began and what the patient was doing at the time. EMS providers should ask clear and direct questions. Understanding the onset helps distinguish between acute and chronic issues, guides treatment decisions, and provides critical information for hospital staff. For example, in the case of a stroke or cardiac event, knowing the exact time of onset can directly influence life-saving treatment options like thrombolytics or cardiac interventions. Documenting this accurately also helps paint a clear timeline of the patient's condition, which improves communication with other healthcare providers and ensures the patient receives appropriate and timely care. This systematic approach ensures EMS crews gather essential clues early, which can significantly impact patient outcomes. Diving a little further into onset, we can look at our classic who, what, when, where, why, and how questions to garner even more information about what is going on, with questions such as, who was with the patient when the signs or symptoms started? Who witnessed the event, be it medical or traumatic? Who was the last person to see the patient well? Determining a patient's last known well time is crucial for effective stroke treatment, for instance, and knowing who was the last person to see the patient well, or who may have witnessed the incident or witnessed progression of symptoms, could allow a receiving physician to contact them later to gather more information, to help them decide on best possible treatments for the best possible outcome. What was the patient doing when the signs or symptoms started? For a patient experiencing chest pain, for example, It would be significant to know if the patient was at rest when these symptoms started, mowing the lawn on a summer day, or running a marathon. When did the signs and symptoms begin? For a patient with a complaint that is traumatic in nature, the answer may be obvious, as it's likely the signs and symptoms began acutely right after the traumatic incident occurred. But what about for those situations where it isn't quite clear if there was a medical emergency before the traumatic event, or vice versa? If you have an elderly patient that has been involved in a minor car accident and is found sitting in the driver's seat complaining of chest pain, it would be appropriately to try to determine if the patient was experiencing the chest pain prior to the accident, or if it began after the accident. Where did the signs and symptoms begin, or the incident occur? It would be easy to assume that the patient would be found in the same place that they made the 911 call from, but that is not always the case. If the patient was in a different environment, and the EMS provider is not aware of this, we could miss a significant contributing factor to the current presentation. Was the patient previously in a hot environment, like outside in the summer, or in an oxygen-deficient environment, like a house where a small kitchen fire was occurring, or a car paint booth with improper personal protection equipment? Why did the signs and symptoms start, or why did the incident occur? Of course, there will be times when the answer will be I don't know, but other times, by just asking a patient if they have an idea why things started or happened, they may be able to offer some insight that they may not otherwise freely offer. For example, a subject with acute onset anxiety and difficulty breathing may not freely tell you that had been involved in a verbal domestic altercation with their significant other, but may be more apt to tell you if you ask a more direct question. How did the signs and symptoms progress? Or how did the incident occur? There is a lot of value in knowing how signs and symptoms progressed, as this can start to create a timeline for your patient. If you're called for a female who has fallen with a headache, it would be valuable to know if she became acutely dizzy, fell and now complains of an atraumatic headache, meaning she did not hit her head during the fall, or if she tripped on a throw rug, fell and struck her head on a table, which resulted in her head pain. When assessing provocation and palliation, EMS providers focus on identifying the factors that either increase or decrease a patient's pain or discomfort. Asking questions like, what makes the pain worse? And is there anything you do that makes it feel better? Helps narrow down potential causes and guide treatment decisions. Provocation can involve physical movement, pressure, or even emotional stress, while palliation could include rest, medication, or changes in body position. Understanding these patterns allows EMS personnel to tailor care more effectively in the field and provide clear, useful information to hospital staff upon transfer. It also helps differentiate between injuries, medical conditions, or environmental factors that could be contributing to the patient's symptoms. This level of detail ensures that patient care is both thorough and targeted, improving comfort and safety during transport and handoff. When evaluating the quality of a patient's pain, EMS providers rely on the patient's own words to describe how the discomfort feels. Encouraging patients to be specific, using terms like sharp, dull, throbbing, burning, stabbing, or aching, gives important clues about the underlying cause of the pain. For instance, sharp or stabbing pain might suggest an injury or nerve involvement, while dull or aching pain could indicate muscular or organ-related issues. This type of descriptive information helps EMS personnel develop a more accurate clinical impression and guides appropriate treatment decisions during transport. Additionally, documenting the quality of pain allows for better communication with hospital staff, giving them valuable insight into the patient's condition before more advanced diagnostic tools are used. Asking about quality not only helps in assessing the seriousness of the situation, but also shows the patient that their experience and comfort matter in the care process. A key practical factor for evaluating the quality of a patient's pain or discomfort is to try to keep the questions as open-ended as possible. Asking this question with, "In your own words, how would you describe your pain or distress?" will, with most patients, garner you much more information, as sometimes patients will simply say yes to anything. To avoid situations where you might ask a question like, "Is the pain sharp, dull, or throbbing?" and the patient answers simply yes, try to get them to provide as much information as possible using their own words. Of course, this won't work with every one patient. You may encounter patients who, due to the nature of a medical condition or emergency, developmental issue, or acute stress reaction, cannot seem to articulate how they are feeling on their own. In these cases, you may find asking simple yes or no questions is the only real way to gather any information at all. However, remember, the accuracy of this information could become questionable. Tread carefully. When assessing region and radiation, EMS providers focus on determining the exact location of the patient's pain and whether the discomfort spreads or moves to other parts of the body. Asking questions like, "Can you point to where it hurts the most?" and "Does the pain stay there or travel anywhere else?" helps narrow down potential causes and can reveal patterns linked to serious conditions. For example, chest pain that radiates to the left arm, jaw, or back could signal a cardiac event, while abdominal pain that shifts location might suggest appendicitis or gallbladder issues. Understanding both the primary region and any radiation ensures that EMS providers gather essential information to guide pre-hospital care and alert hospital staff to possible life-threatening conditions. This step also helps prioritize treatments and transport decisions, ultimately improving patient outcomes by ensuring the right care is delivered as quickly as possible. When assessing severity, EMS providers ask patients to rate their pain on a scale from 0 to 10, with 0 meaning no pain and 10 representing the worst pain imaginable. This simple but effective tool helps quantify the intensity of the patient's discomfort and provides a baseline for comparison as treatment progresses. Asking, "On a scale of 0 to 10, how bad is your pain right now?" allows the patient to communicate their experience in a way that guides both immediate care and ongoing evaluation. Tracking changes in severity can show whether interventions like oxygen, medication, or repositioning are helping, and it ensures consistent communication with hospital staff during handoff. Using the pain scale also encourages patients to actively participate in their care and allows EMS providers to prioritize interventions based on the level of distress the patient is experiencing. Remember, EMS providers can also use this severity scale to help patients gauge and communicate their levels of distress. Of course, with pain we ask, on a scale of 0 to 10, with 0 being no pain and 10 being the worst pain you have ever felt, how you rate your pain. But don't forget, we can also ask something like, on a scale of 0 to 10, with 0 being no distress and 10 being the worst distress you could imagine, how would you rate your distress? Or, if we're dealing with something specific, like a psychiatric emergency, We can ask something along the lines of, on a scale of 0 to 10, with 0 being the best day you've had or the best that you have felt, and 10 being the worst day you have ever had or the worst that you have ever felt, where would you say you are right now? Again, you're allowed to be a little creative and modify some of these questions to fit your needs. These aren't written in stone anywhere. Nothing says you can't change them up to make them work for you and your patients. When assessing time, EMS providers focus on understanding the duration and progression of the patient's symptoms. Asking questions like, how long have you been experiencing this pain? And has it been constant, or does it come and go? Helps build a clear picture of how the condition has developed. Knowing whether the symptoms began minutes, hours, or days ago can guide treatment decisions and help differentiate between acute medical emergencies and longer developing issues. Additionally, asking about changes over time, whether the pain is improving, worsening, or staying the same, provides valuable insight into the severity and urgency of the situation. It may also be appropriate to ask some additional questions regarding time, such as, is there a time of day, like first thing in the morning or at night, that the patient's signs and symptoms are better or worse? Before or after certain activities, are the signs and symptoms better or worse? Documenting this information ensures that both EMS crews and hospital staff can make informed decisions about care, allowing for quicker diagnoses and more effective treatment. Opqrst is a systematic approach used by EMS providers to assess a patient's symptoms, particularly pain or discomfort. It guides the provider through a focused set of questions that help determine the onset of symptoms, what provokes or relieves them, the quality and type of pain, the specific location and any radiation, the severity of the pain, and how long it has been occurring. By using this method, EMS personnel can gather detailed, relevant information quickly and efficiently, leading to a more accurate field impression. Opqrst not only supports better clinical decision-making, but also improves communication with other healthcare professionals during patient handoff. It's an essential tool that enhances the quality and consistency of pre-hospital patient care. You arrive and find a patient who is experiencing chest pain. After a thorough patient interview regarding their history of present illness and assessment, you are able to provide the following patient care report to the receiving ALS crew or receiving hospital personnel. Patient reports chest pain that is sharp and stabbing, that seems to originate in their left chest with no radiation reported. Point currently rate their pain as 7 out of 10. Point reports the pain started approximately 30 minutes ago, and that it has been consistent since onset. Remember, Opqrst is a systematic approach used by EMS providers to assess a patient's symptoms, particularly pain or discomfort. Mastery of Opqrst improves assessment and care by guiding EMS providers in garnering as much information as possible from patients, bystanders, or other caretakers. while utilizing questions that will maximize efficiency and relevant information. Always, and in addition to when using any mnemonic, it is imperative for EMS providers to engage in active listening, meaning listening must move beyond only hearing the words the speaker is saying and maybe copying it down, but being able to process, understand, synthesize, and use the information obtained from conversations. It is also imperative that EMS providers completely, adequately, and accurately document all pertinent information from a run. The age-old adage still rings true today, even in the modern day of electronic patient care reports and AI generation. If you didn't document it, it didn't happen. Remember, it is not anyone else's responsibility, not even an AI-generated program, to ensure that what you know needs to be included in a PC or is there. Double-check everything for inclusion and accuracy every time. Finally, it is not enough to learn assessment techniques while in your initial training course. If we think of our brain like an iceberg, and everything we know and learn is penguins, you have added a lot of penguins to your iceberg since you graduated your classes, became certified, and began working as an EMS provider. Inevitably, some penguins will fall or be pushed off the back. Don't let the important penguins, like your assessment techniques, in this case, be one that goes off the back. Let those important penguins be the ones that you tend to care for. Let them be materials that you regularly review and practice, so that the penguins that are falling off are your 6th grade locker combination or something else as equally unimportant. Thank you for completing this lesson. We hope you found the course informative and valuable. Please proceed to the post-test to assess your knowledge of the topic. And that you for visiting easyems.com.